I want to make sure we cover hormone replacement therapy and some of the stigmas around it. Can you tell us a little bit about the history of how this came about? And yeah, one particular study that just keeps coming up as like this problem child that anyway, the story is so weird. And if you're familiar with any kind of story in the health world, how studies are done or whatever, you're pretty familiar with a lot of scams and scandals and all this stuff. But can you tell us a little bit about hormonal therapy and how this came about?
Yes, the biggest disservice to women, 2 generations of women at least, was done with the Women's Health Initiative study. This took the study design. First of all, I don't know what clown designed this study, but it took women who were 10 years out of menopause and then said, oh, gee, let's replenish their hormones derived from the urine of pregnant horses. Because, wow, that seems biocompatible with a woman's physiology who's 10 years post-menopause.
Is that as weird as it sounds? Like, right now, is that like, that sounds to me really weird. I don't know much about pregnant horses, but
yeah. Yeah, no, not taking synthetic hormones derived from that. I can't believe they got women to volunteer for this study. And like, these women must have really been suffering and looking for some alternative. And they then concluded, when the study was done, that, oh yes, hormones are dangerous. You're putting yourself at risk for clots, strokes, and heart disease. And you're going to die taking this stuff. So they took women off. I think it was Prempro was the name of the hormone. In 2018 and in 2022, the the North American Menopause Society put out position papers saying, yeah, that was a poorly designed study. The data is really not quality. And actually, what we're learning is that hormones, especially bioidentical hormones, are not only safe for at least 10 years post-menopause, but beneficial in preventing chronic diseases of aging, such as Alzheimer's disease, bone loss, and heart disease. And they have 0 to minimal risk of stroke or heart attack or blood clots. The problem is, so yay, that's a total victory. The problem is the pamphlets in pharmacies have not been updated, right? You get this long warning label. Doctors' offices are not updating their pamphlets either. And again, women are just being given the pill or an IUD for a prescription versus bioidentical hormones. And it's like, it's so egregious to me. One of the stories I put in the book was one of my clients said, yeah, I went to my GYN and I was like, I'm not sleeping at all. And she was like, well, if you want, I'll give you a prescription of the pill. What I personally do is take Benadryl shots every night. And I was like, don't you, as a female doctor going through menopause, don't you want to solve your own menopause? Like, why are you settling for crap care? And I think it's because her doctor didn't know a damn thing about it either. So, that's what I really don't understand, is why female doctors going through menopause aren't looking for better alternatives for themselves either. It's very interesting.
Yeah, I mean, it sounds like the nutrition guidelines from 2015, where it's like cholesterol is no longer a nutrient of concern. They don't come right out and have a parade and tell everybody like we were wrong. Like, it's buried on page 34 of the driest report you've ever seen. Like, they don't come out and tell you this kind of thing. So what is the difference between bioidentical and synthetic hormones? This is not something I understand super well.
So bioidentical hormones are plant-based. They are physiologically compatible with our bodies, meaning if you are taking orally or topically a bioidentical hormone, your body can't distinguish between your own either ovarian production of hormones or adrenal production of hormones, because after menopause, the switch flips and really your adrenals pick up the slack when your ovaries shut down with hormone production. So the delivery system can be in what's called a troche, which is a lozenge that gets absorbed through the oral mucosa. You can use patches, you can use creams, you can use vaginal inserts. Synthetic hormones, synthetic hormone replenishment is derived in a laboratory. It's less biocompatible and it doesn't have the same physiological benefits. In particular, progestogen, which is the synthetic progesterone, doesn't hit up the neurotransmitters in the brain the way bioidentical progesterone does. So let's say a woman comes to me with insomnia and she's perimenopausal. I'll test her hormones and often discover, her progesterone's really low. Well, progesterone is a precursor to GABA, which is a very calming neurotransmitter. And so when you give a woman progesterone, all of a sudden, she's calmer. Progesterone's like a kitten and estrogen's like a tiger, right? So when you bring in more of the soft little kitten into your chemistry, you're just going to feel more balanced and happier. And, your periods will be a non-event if you're still getting them. So it's really important that, bioidenticals are also much more easy to customize and titrate. I mean, you can take that lozenge, or it's called a troche. You can take a troche, you can cut it into quarters if you want. With creams, if you're applying a syringe, you can adjust the dose in the syringe. In one day, you can adjust your dosage. Synthetic hormones, harder to regulate and adjust. And also the big no-no, you want to stay away from our hormone pellets, because that's also another branch of hormone replenishment where doctors insert pellets into your butt muscle basically and close you up and then just let the hormones release, on their own time. So you have no ability to regulate. There's a lot of side effects that I've seen in my clients, like weight gain, irritability, a sex drive that scares the hell out of their partners, but also hair loss on their head and hair growth on the face. So it's really hard to regulate. And there's no studies on troches. There aren't a lot of studies on bioidentical hormones, but there's enough to at least justify their usage. And I put a lot of them in the book.
Wow. Yeah. And I really appreciate that you made a post about that recently, about the pellets. I'm just curious, is it the same for dudes as it is for females? I know a lot of guys were getting a lot of pellets injected every 6 months. It seems like that would also not be the best idea. Is that correct?
Yes. I mean, I haven't seen a ton of men in my practice, but the ones I did see over the years with pellets, their estrogen was aromatizing to, their testosterone was aromatizing to estrogen, and they became estrogen dominant, and they were coming to me for weight loss. And I was like, get off the pellet, just use a topical cream, or a gel, because you don't need to. You can even give testosterone via a troche, so it bypasses the gut and the liver. But yeah, I really don't like the pellets at all. And also the problem is the dosing, right? When a woman is postmenopausal, she does not need to have the hormone levels of a 20-year-old. She's not trying to ovulate and reproduce. So our hormones can naturally be lower. And really the replenishment dose is about a fifth of the dose of a birth control pill. So
Wow.
the pellets jack your levels up to 4 times of what your baseline is. So the minute those levels start to decline, menopausal symptoms come back, the fatigue comes back, the low energy, the brain fog. Testosterone is very important for women, very important, but the delivery system can be a lot more relaxed. You don't need a Ferrari at this point, ladies. Like a Jeep is real solid, will still get you there and will work great.
Wow, I love that. Thank you. That was such a great explanation. And from what I know about the women clients that I have that are on bioidentical hormones and hormone replacement therapy, all I know is that they know that it is necessary. They feel amazing when they're on it. And if I said, you can't be on it anymore or whatever, they would probably stab me in the neck. They describe like what it's like to be off of it, or before they were treated and afterwards. You've already described a bunch of the health benefits, but are there any other health benefits that people notice when they're on the right hormones and given the right way?
Yes, cognitive function. And this is the biggest issue, that cognitive function and mental health changes are totally unaddressed in perimenopause and menopause. And, and all 3 hormones work synergistically. People think, oh, you just need estrogen for cognitive function. You need estrogen, progesterone, and testosterone. Each hormone handles a different segment of your cognitive function, and I may not get exactly right which does what, but across the board, forming new memories, learning new concepts, differentiations with your vocabulary. How ironic that my brain is crapping out now, but you really do need all three hormones in conjunction with each other for cognitive function and a reduction in brain fog, for mental focus as well. And the cool thing is, I can tell you, remember a while back, I told you I had a flat cortisol curve. Like, I had been on adrenal supplements. I did all the lifestyle pieces. What brought my cortisol curve back was when I added in hormones.
Wow.
I actually have a cortisol curve now, and I'm able to lift weights, but it took me going on hormones to do that. Just nothing else did it.
Wow.
And people ask, are hormones really necessary? I feel fine. Absolutely. Just take bone density alone. The research shows you can take your calcium and you can take your magnesium and all the trace minerals and your vitamin D and get sunshine and eat whole foods and do weight-bearing exercises. You will still struggle with bone loss if you don't have estrogen in the picture. So if you are someone who is on, estrogen blockers, you have cancer, you've had cancer, talk to your doctor about it, because I have plenty of women who I treat who have gone through cancer treatment, and the doctors are actually okay bringing in some low dose estrogen because the quality of life issue outweighs the risk of cancer. So work with your doctor to truly assess your cancer risk. And there's a great book on the subject that I list in my references called Estrogen Matters. And it is a wonderful book and just talks about how, estrogens and hormones really aren't necessarily causing the cancer. It's really the detox pathways that are the problem. People are so terrified they're going to get cancer. And if your liver, this is why I do the testing I do, I look at hormone and gut testing and make sure you're detoxifying in both the liver and the gut. And when you do that, you are going to move your hormones out. They're not going to go down the pro-inflammatory pathways. They're going to clear out of your system, and all systems are go.
Wow. Wow. There's like 20 amazing gems in that explanation. I absolutely love that. I love that. I love that the standard of, or not the standard of care, but like with cancer, having a good quality life, I think is so overlooked. We know cancer treatments are absolutely brutal and awful on people. And so to be able to do anything to improve, the likelihood that you would even, let me rephrase that. I think it's so important with the threat of cancer being so low on such a low dose of hormones. People need to know that, because there are people that are scared about this kind of thing. I had no idea about the cognition and hormone therapy. I think that's amazing. And I can just say anecdotally, I know 2 women who are doing it, and they are in very high pressure, high stress jobs, and they crush it. They can work long hours. They do really well professionally. And I wonder if other people who don't have that advantage probably wouldn't be able to perform at that level. And again, that's just pure anecdote from women that I see, but it's certainly something that I noticed, and I've never put the 2 and 2 together.
Yeah. And well, and you're like, so many women, we walk into the room and we're like, wait, what am I here for? And then you go back to the place you were before and then say, oh, right. And then you walk into the room and then you check your phone, and then like a text comes in and then you forget all over again. So it really is important to have the support for cognition, neuroplasticity, focus. All of that is so key to run a successful business, to run a family. I'm not saying I don't forget things. I still come home from the grocery store, even with things on my list that I have not gotten. I'm like, well, that got overlooked somehow. But usually that's from me multitasking and not really focusing. So I do have to work harder at focus than I used to, but still I can run really long days and be okay.